So this side bending test is a test of immediacy, which means it needs to happen immediately. So you're going to palpate the C2, and you're going to induce a side bending. Okay? Now you want to have the gravity. You already have a little bit of compression going through, so you're just going to give just a little bit of compression as she side bends. All right, and you're going to induce that side bend. You should feel that C2 pop into your right finger right away. All right, this is what we did. This is how you start the CV locking. All right, so if it doesn't happen, then the thought is that that might be a problem with the alar ligament. Okay. Now some people feel that in and of itself is enough to test the alar ligament. However, other people feel that even with a tear of the alar ligament, you can still have normal biomechanics because of gravity. All right. So the other way to do it, have a seat, or you are sitting, have a lie down. The alar ligament will check end range side bending, even if it doesn't necessarily have to. So what you can do is you can come in and you can stabilize C2, and then you grab the occiput, and then you side bend. And when you get to side bend and you get that check, you're going to give a little counter pressure, and it's going to look like this. It's almost like you're taking C2 and you're side bending it this way. Okay? It's like you're side bending the C2 in space to the left, while you're taking the occiput and you're side bending it in space to the right. Okay, so I'm coming in like this, and I'm doing this. That's a stress test for the alar ligament. Which side? The left alar ligament. I'm getting for that end feel. I'm looking to feel an end feel, and I'm making sure that I have a good solid check to that. Okay. So we come in, palpate, first spinous process, either side, shave the back of the head. Okay. So I come in here, get nice and close. I side bend. I'm going to do it to the other side so you can see on that side. So I side bend this way, I'm counter pressing. You okay?
Yeah.
Okay, I get to the end range, and I get the end feel of a ligament. I do the other side, so I'll come on this side, go right around C2, right around the occiput. I hug this way. I'm checking her head with my shoulder. Okay, bring her in. So now I've created a functional unit between her head and my body and my shoulder. I counterbalance. This is my C2 side bend like this. I side bend the head this way, and I feel for a check in motion. Okay? If you don't feel a check in motion, it might be okay, because the thought is that you may need to flex her a little bit at the CV and do the exact same thing, or you might need to extend the CV and do the exact same thing. She needs to check in one of the three planes: neutral, slight flexion, or slight extension. And when she checks, you give it that extra stress test, she's good. Okay? And the reason is that the anatomy varies from person to person. So not everybody's going to check in neutral. Okay? All right. And since you did you guys do both of these? Yeah, that would be good to know. All right, so the whole time that you're looking, what you're worried about is stress that's going to happen to the vertebral artery, and a tear in the ligament. So you're watching them. You're watching the eyes. You're watching the skin. You're watching for any neurological reaction. For if have them talk. Say, "How you doing there?" "Oh, I'm doing okay." If they have dysarthria, they can't speak. All of these things could be a sign that you're stressing the upper cervical. All right, so that's the symptoms that you're looking for as far as she's concerned. Yeah. Well, how long do you tell hold it for? 8 to 10 seconds? Really? All right. I don't do it. All right. Hey, hold it for 8 to 10 seconds, because you're gonna. That's when you can get the signs from that. The other thing that you're looking for is the ligamentous check. So for a ligamentous check, you don't hold it for that long, but you're just trying to get that firm end feel. But you need both. You need to have that 8 to 10 second hold without having any cranial symptoms, and then you need to feel that firm end feel so that they have that check.
And keep the eyes open.
Yeah.
Patients like to close their eyes.
Yeah.
You can't see the diplopia.
Yeah, so you can see if they start getting into the nystagmus, or if they start to see the double vision or things like that. Right? Okay. All right, practice that one.